Hello guys, so today I'm gonna discuss with one of inspirational friends of mine. He's a chiropractor from Taiwan and graduated from Palmer College, San Jose, California, United States. Let's go to see him on the screen. Chiropractor Dr. Chiang from Taiwan. Here it is on my screen. How are you, doctor?
Pretty good. How are you, Calvin?
Doing great
Been a
here.
while.
It's been a while, yes, haven't seen you. And how's everything going back in Taiwan?
It's been great. I've been working and just been treating patients. Yeah. So yeah, it's been good.
And what is chiropractor is? Probably some people still unfamiliar with chiropractor.
Yeah, well, I'm sure in United States most people is familiar with chiropractic or chiropractor, but in Taiwan or some other Asian countries, we don't know what chiropractor is. And it's another healthcare system. It's like we kind of looking at our body as a whole. So we don't treat, if there's someone with a headache, we don't just treat their head, or if they have leg pain, we don't just treat the leg. So we actually looking at the body as a whole to just see what's the real cause of headache or other parts of problem like back pain. Is it from upper to lower or from lower to upper? So we need to see what's going on, and then we'll have some like neurological test, and then muscle test, and some different kind of way to do the examination to see what's really going on with the body. Yeah, structurally saying, but for chiropractor, it's really, we have a lot of freedom to do what we like to do. So for me, I do structure and chemical. So structure, like I said just now, I treat like muscle or any neurological, some just dysfunction, and then for chemical, because sometimes we see people may have back pain coming from some infection, or we have some skin problem. It's mostly always coming from the infection too, because we see that for example, in Taiwan, a lot of people have skin problems. So like some atopic dermatitis and things like that. So because they don't have any cuts or any infection from outside, but actually it's coming from the inside. We suspect that they're under some like their immune system is not functioning as well. So we'll suspect maybe there's some infection in the gut. So, and then that will just bring out the symptoms as skin problem. So a lot of people in Taiwan, they've been using like some cream or taking antihistamine to kind of just suppress the symptom, but not actually taking care of the cause. So we're looking at the cause. That's what chiropractic is. To just see what's the problem real is.
So this is really interesting. That I have a question. What's something intrigue you to be a chiropractor? So do you have like a background, family background as a chiropractor, or what was it?
Yeah. So that was back in when I was in the college. So I was in University of Washington, and I was studying biochem, and I have a friend who is studying biochem as well, and he has really serious migraine. Migraine is like headache, and his migraine is called classic migraine. So he'll have before the headache, he'll have aura, which is seeing white light in his eyes. So you just see white lights. So kind of like a circle white lights. And then afterwards, after the aura has gone, then he'll just experience this really excruciating pain in his head. So he couldn't do anything. He just had to stop whatever he's doing. Sometimes we're playing computer games, or sometimes we're studying together, and then he just has to just lay on the side just to rest, and then couldn't really talk as well. So I can see that it's really painful. And then he's been going to many different hospital and then take the image, and then but there's nothing wrong with it. Nothing wrong with his head. There's no tumor. There's nothing that's compressing on his nerve. So so he's been trying a lot of different things, but just afterwards, then he found this chiropractor that was when we were in Seattle, and then he found out that that chiropractic just actually doing cranial work to just take care of some imbalance in the cranial system, the dural system, and the whole spine, and also the pelvis. So everything is all aligned, and then he also found that he is lack of GABA. GABA is a neuroreceptor in our neurological pathway. So he lack of GABA, and maybe that's the two symptoms, the two cause for his migraine. And then he's been doing that for maybe a month, or about a month of treatments, and then his migraine is gone, like for good. So he so that was 2000 maybe 13 or 2000, yeah, about 2012 or 2013, and then till now there's no symptoms of migraine at all. So at that moment I thought, wow, this is pretty amazing. So I just decided to step into this profession.
You're currently in Taiwan, right? So may I know what's your practice?
Where's my practice? It's in Taipei and in Taichung. So I practice in both places.
So you're back and forth to those places?
Yeah, back and forth. Well, I'm glad that there's a high speed rail, so just 1 hour of travel. So it's not too bad.
Great job. So if I wanna have a treatment with you, like how long do I need to spend my time for every treatment, and how long would you spend with your time too?
Well, it depends on the what you are experiencing right now. For example, some people may take a longer not treatment time, but I mean maybe longer period of time during the whole different sessions of treatment. And then but so I can guarantee who like 1 week treatment you'll be fine, or like a month you'll be fine, or 2 months you'll be fine. So it depends on the person. But each session for the first session I will take maybe 1 hour to 1.5 hours.
Wow.
To understand, to really take the history and then do examination, and then just communicate with the patient to understand what he really needs, and also let him understand what I'm doing. So that would take a little longer for the first treatment and the first visit. And then so the second visit maybe 30 minutes or 20 minutes, so less than that, depends on what I see every session. So so first will be a little longer, and then other session will be shorter. Yeah.
Good job. So every time I heard the word chiropractor, I always like watching from the YouTube, chiropractor things, and then I heard like sounds cracked, or like they say like if you're going to chiropractor, that means you gonna get cracked by the chiropractor. And what's that mean?
Yeah, well, it's actually cracking. The sound cracking sound, like it's actually coming from like this is two section of spine, right? Two different bone, and then in between there's like it's like kind of like a joint. So spine is like different bones connecting, and then between the bones there's joints, and then cracking sound is coming from when we're kind of adjusting the spine, adjusting a bone from another bone. There are some gas trapped inside. So when we adjust it, the gas just kind of escape. So that gas is usually CO2 and then carbon dioxide. And then so you can think of it as just like opening a soda pop. opening a can of Coke, and then just pop, that kind of sound. Yeah, so it's like gas escaping from the joint. So it's not really bone, just kind of scraping on bones, but it's actually when we are kind of freeing the space, the gas coming out. Yeah. So, but we're not going for the cracking sound. That means we got adjusted, but there are a lot of different adjustments. So that just one way we can adjust the body.
So is it really hurt in every adjustment and in every correction? Because like the sound is really bad and scary.
It it depends. Some people can experience some little bit of pain, but shouldn't be too much pain. Yeah, but usually the adjustment shouldn't be painful. Yeah.
So doctor, so how chiropractor works when patient come to your office? What are you going to do, and what the type of treatments usually?
Okay. So most chiropractors, they do adjustment, manual adjustments. So there are a lot of different techniques. So every chiropractor has their own opinion and their own approach taking care of the body. So for some, they do diversified. So just kind of like adjusting the cervical, thoracic, or lumbar, the lower back. Yeah. So, and then some people do SLT, so which is like balancing the cranium and also pelvis. And some people do activator. You might see it like it's like a clicking, kind of like clicking pointer, clicking gun. And yeah, so there are many different adjustments. So I guess we mostly people would see it as the manual adjustment, like diversified. So which is like kind of aligning the different section of the spine. So maybe we can show the people about this, like what we did before. Okay. Yeah. So this is, I guess that's the most common way most chiropractors do that. Yeah.
So you do adjustment with your hand, right? For the manual
yeah,
one?
most adjustment do that. Yeah, for that one. Yeah.
And do you have like any special machine for yourself to help?
Yeah, I sometimes I'll do when we balance the pelvis, we'll have some special instrument, and then also some people use there's kind of like a massage gun, but it's actually it can go deeper into our kind of like fascia, deeper into our fascia, because sometimes when we have this scar tissue, we need to use this kind of like a massage gun called percussor to break the scar tissue in the fascia. Yeah. So different ways of treating a patient. So we just treat accordingly.
Okay. Thanks for our discussion, Dr. Xiang. And the end of our discussion.
Yeah, no problem. Thank you. Okay, lay sideway facing me. Yep, very good. Just relax. Okay, and just relax. Okay, just relax. Okay, hold here. Okay, just relax. Put some block underneath your pelvis. To mold your pelvis back. Hold here again. Okay, very good. Okay. Breathe in and breathe out. Muscle test to see what's going on with each muscle. Hold here. It's weak and hold here. Okay, very good. And then let's check gas this time. Hold. This something, and then hold. Okay, this side, this is weak too. And then hold here. That's weak. Okay,